Hi, my name is Brian Plaster, and I'm 40 years old. I was born here in Las Vegas, Nevada, and just about a year and a half ago, a little over a year and a half ago, I was up here snowboarding, and I crashed into a tree. And it was one of the worst snowboarding accidents I could possibly imagine. I remember crashing into the tree, and my knee was essentially flopping down below my leg. So that day I was pretty darn scared, and I wasn't sure if I'd run again, bike again. I wasn't sure what I would be able to do. So when I finally did meet Dr. Otten, I was very happy and very relieved to know that there was something that could help my knee without going through surgery.
Brian initially came to me with a high-grade sprain of the MCL, otherwise known as the medial collateral ligament. This ligament creates stability in the knee, and Brian was a high-distance runner, specifically on trails or off-road. So he needed strong stability in his knee, and this was hindering his ability to run these ultra marathons upwards of 40 miles on trails. Brian came to me initially anticipating surgical intervention, but it was our goal in this particular situation to avoid it because number one, he has kids and he wants to be a dad and play, but number two, he was turning 40 and wanted to run a long 40-mile off-road race. Because of his specific injury, I recommended adipose-derived stem cells versus bone marrow stem cells. Adipose-derived stem cells has a very high concentration and count of mesenchymal stem cells, and it's ultra concentrated. Adipose-derived stem cells has the ability to turn into tenocytes or tendon cells and ligament cells, which is what Brian was after.
The injury happened back in March, and then I had the stem cells put in over the summer. I believe it was July, and by September I was good to run again, good to mountain bike again. Prior to the injury, I was spending a lot of time mountain biking, running, doing CrossFit classes, snowboarding, essentially a lot of outdoor activities, and that's what I wanted to make sure I could maintain by doing the stem cell treatment, being able to do the activities that I've always done my entire life.
Brian had done so well at 3 months that the brace was off, he was running and walking on trails and performing daily activities without significant pain. And he was even running high distances at that point in time. We actually did a follow-up MRI because he did so well with his case. The MRI at 6 months after the procedure showed only minimal changes of the MCL with just a little bit of swelling, but complete resolution of the fibers and the tear. For these injuries with tendons and ligaments, stem cell therapies have the realistic potential of negating the possibility of surgical intervention.
Frankly, the injury got me a little bit more focused on these athletic activities, and right after the injury I was able to do a 40-mile race on my 40th birthday. So running 40 miles on my 40th birthday after destroying my knee prior to that is just it's a huge blessing for me to be able to get out here in the outdoors and just experience nature, be in the place where I love, where I want to be most of the time.